very soon. But we want to do our roundtable, and then maybe along the line or just before we wrap up the show, we bring you the Eid conversation. I understand that my guest who is going to join me is on the prayer grounds now, and he is actually going to pray. And so once he's done, we're going to bring you that conversation so you get to understand exactly what Eid is all about and how you can celebrate, whether you're Muslim or not, the best way to be able to celebrate that. And so we'll talk about all of that shortly. But right about now, we get into our roundtable discussion. And today, like I said, we're marking Oral Health, World Oral Health Day. And that is why we're having this conversation here. Now, if you are just tuning in, we are saying that oral health is not just about clean teeth or fresh breath. It's deeply connected to your overall well-being. And today we're moving from awareness to conversation. I'm not having this conversation alone. I'm joined this morning by a professional who deals with this every single day. He's a dentist. His name is Harry B.K. Glover. He's a dentist and also the CEO of Life Healthcare Center. And he joins me for our special World Oral Health Day conversation right here on the Business Breakfast on Z. Should I call you doctor or
anyone works? I was me before I became a doctor.
Okay, right, yeah, but I prefer to call you doc. Yes, I like to give people their accolades. I mean, for things they worked hard for. So, yes. Anyway, you're welcome to the Business Breakfast.
Thank you.
Right, thanks so much for making time to be
You're
part
welcome.
of us this morning. And you're spending your holiday. I know you should be sleeping or resting.
No, it's the from here I'm going to work.
Oh, I see.
Yes.
You work every day.
The holiday, because corporate Ghana is quite tight now, so the holidays and the weekends are when people have time to visit the dentist. So
Okay.
it's quite busy on the holidays.
On
and weekends,
holidays,
yeah.
right? Okay, all right. Anyway, let's start from the top this morning. Now, why do you think that oral health is such an important thing, but people overlook it? Because I see that a lot. Why do you think that is the case?
So for when a kid is born, the first thing that helps a kid survive is to put the breast in the mouth, the nipple in the mouth to suck. If they didn't have the mouth, survival is non-existent.
True.
The kid would not make it. Then as you grow, that's what helps you chew. That helps you smile.
Yeah.
That helps you speak, because some words, depending on how the pronunciation is better when you have your teeth. When you lose your teeth, you are not able to mention some of the consonants very well.
Right.
And then also, and now that social media has become a big thing, your smile is extremely important.
Very important.
But people take it for granted because they have 32 teeth. Yes.
How so?
Because they feel that when one is gone,
Okay.
they are
so
just
31.
to function. And and also some may not take it for granted, but the stories they've heard. The dentist takes out your teeth. The dentist causes pain. The dentist does this. So some is also bothered with past experiences and fear.
Right.
Yes, fear of that's the fear of this of the unknown and fear from stories that they've heard.
Okay.
So that's why people would take it for granted. Yeah, because they are, if you've got two eyes, if one is gone, you've got one eye. You've got a nose. If your nose is cut off, it's difficult. But because you've got 32 teeth,
people think that
it's gone.
we can still manage and all of that.
Yeah.
I see. But do you think there's a lack of awareness?
Big time.
Largely.
Big time. You see, our numbers as dentists is even quite small. Yes.
You mean the number of dentists?
That is in the country.
In the country. Oh, okay.
Yes, it's quite small. Off the top of my head, I don't think we have up to 2,000 dentists in the country.
Really?
Of 32 million, of over 30 million. And with dentistry is quite expensive, even with the training. And prior to recent years, that you now have a dental school in Kumasi and as you have in the whole UDS, and then my alma mater, University of Ghana. The numbers, my batch, at the time I was training, my batch produced only 13 dentists. So that year, 2008, when I finished, the whole country had only 13 dentists produced.
Wow.
Yes. So oral health is now getting into people's minds. Then also you realize that even with the health policies and all that, there was much emphasis placed on malaria, on TB, on
HIV,
yes, all those things.
Right.
You know, so dental wasn't giving that much funding and that much backing. So it's really that you have a lot of private health insurances, that you have a lot of clients in corporate Ghana trying to access the dental care. But prior to that, it was done.
But why do you think people are not going into it? Is it because it's expensive?
No. So back to that, everybody who's growing up, what we know is this: the stethoscope. Everybody finishes wants to be a doctor. Dentistry was not, once again, was not that well marketed. People saw you as people also at that point declined dentistry because they felt that they didn't see it as a specialist area.
Okay.
They saw that you were going to learn just about 32 teeth. That's not exciting. But it's a whole world. It's massive. It has got several disciplines, several subspecialties. So, with lack of knowledge, people didn't want it. But now the numbers are picking up.
Gradually.
Yeah, numbers are picking up.
Gradually. Yeah. So what do you think is what are we getting wrong at the mindset level as a people? Generally, in terms of not specifically on becoming dentists or studying to become dentists, but generally about oral health.
Yeah, in oral, I don't think that at the end, you see, people would only once when you interact with clients and you are trying to convince them to fix their teeth, they say, "Oh no, look, take the tooth out. I've got other teeth." So I'm saying, that's what I put across earlier, the fact that you have got 32 teeth. But the other thing is that with the older dentists back in the days, the dentistry was quite crude, right? So and because it was a limited number,
right?
And they have a lot of patients to see.
Okay.
So they were more towards, you go, I inject, I take out. You go, an injection, you take it out. And with individual differences in makeup, the amount of anesthesia that helps you work as a dentist varies from person to person. But for some of the older folks, those days, what they tell us is that when they go, they are injected, have to go and sit outside. But then you come back and anesthesia is one off or not, they are pulling out your tooth. So some of them had very, very horrid experiences.
Right.
So some of them don't want to hear the dentist at all. So you have the current generation. I have parents who bring their kids who will not have the treatment done when the kid is there because they are afraid of the dentist. But the kid is very fine. The kid comes, will chat with me, and will do the procedure.
Everything.
So maybe from the generation coming up, they would be more exposed and more educated than the older folks.
The older folks. I see. All right. Now, so let's talk about the topic that we have this morning. So people usually say that our oral health really is part of our general well-being or overall well-being. What does that mean?
It's said that the mouth is a window to your body because almost every disease has an oral manifestation.
Okay.
So if you have lack of vitamin C, you will see your gums bleeding. If you have diabetes, it shows in the mouth. Some heart conditions, you would have issues in the mouth and all that. So it's one that if your teeth is in good shape, basically that's your teeth are one of the most important things, and your mouth.
Okay.
One of the important things that help you survive because that's where your water passes, that's where the food you chew passes, that's where the smoothies or whatever you're going to eat, that's where it goes through. So without it being on point, it will affect your general being. Yeah, so they're also moving down to mental health. People smile. People don't like their teeth. People are teased in school. So yeah, the state of your mouth and how your teeth looks also has an effect on your mental well-being.
Right.
So that's why
your confidence.
Your confidence. Yeah, it encompasses the whole being. It's not just they're not just 32 teeth. If the tooth is gone bad and there's a lot of pain, sleep is not your friend. You cannot sleep because the pain is worse at night. And the pain from dental issues is only, I said, is only second to labor. So you have you have it said that when you have a healthy mouth and everything is on point, it's because definitely if you're having to take and you cannot sleep, the following day your productivity is less. So it's generally the health of your mouth reflects on your total well-being. Yes.
And that is why. So why should people take it serious?
Because that's what makes you.
Okay.
Because that's what when you are on you're on TV or you are going for an interview and for instance you have no teeth and you are talking on the panel. You look at them and you are wondering. Even you come down even to the military and police recruitment.
Yeah.
When they go for recruitment and they have issues with their teeth, they have to fix it before they come back. Yes, so it's one that you must take very seriously because the teeth is one body that does not regenerate. Regenerate means that it does not form back.
Yeah.
Once it's gone, it's gone. Once the 32 God gave you, once you take one out, that's it. No, we've tried all sorts of materials, but none of them comes close to what God gave.
Okay.
Yes. And to replace a missing tooth is quite expensive. So that's why you need to maintain what you have.
What you have, right.
Yeah, that was given to you by God for free.
Okay.
No cost.
No cost.
If you want a mortal to intervene, to replicate what God gave, it comes at a cost. So it's one that you must take very, 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 very important. Because once it's gone, it's gone.
Okay.
And then also you realize that with your teeth, the full nature of your mouth, how your smile looks, is there because your teeth are in the bone. Once the teeth come out of the bone begins to shrink. That's why you see an old person who has lost their teeth, their mouth dips in. Because it's the teeth that holds the bone that gives you this full smile, that makes you smile. Once the teeth are gone, the bone begins to shrink.
Yeah.
So it's one that if you lose, it's gone for life.
Okay. All right. So let's talk about the Ghanaian context specifically. So what are some of the common oral health issues that you see here in Ghana, or that people bring to you?
So one for most Ghanaians, okay, as we got more urbanized and more sophisticated, then you're having more people coming down with tooth decay.
Okay.
What we call cacao or what we call caries in dentistry. So you have people, but the low side is that people would come when there's pain.
Right.
And when there's pain, that means that you've reached the end of that tooth. Yes, either I take out the tooth or either I do something we call a root canal. So that's one of the issues that you see. Tooth decay.
Tooth decay. Okay.
Another thing you see is what you see around your teeth. You see that when people are talking to you, you see this yellowish substance around your teeth. In dentistry, yes, in dentistry it's called tartar by the Americans, calculus by the British. It's deposits of calcium and phosphorus around your teeth. Okay. No matter how hard you brush, it will not go off.
Oh, I see.
Yeah, no, you can use the strongest of brushes.
So
you can use smokers.
I wonder whether people are not brushing well, or they are saying that it doesn't go.
It doesn't. You need to have it cleaned off. No matter how hard you brush, it will not go off.
But what causes that?
It's deposits from your saliva. It's a natural process.
Okay.
So, but we all pack. We all have different compositions of our saliva, and it's on the lower teeth especially because your salivary glands in your lower jaw open behind your front teeth.
Okay.
So as it jets out the saliva, it deposits. It's like laying down cement on the teeth. It lays it down bit by bit, and over time it packs. Some people will not need a clean in 2 years. Some people once a year. Some people every 6 months. Depending on how God created you.
Severe it is.
So brushing hard, maybe to think you get cleaner teeth or to get whiter teeth, it's a non-starter. And that's one of the biggest things that you see. People feel that the harder the brush, the cleaner their teeth. Yeah, it's a non-starter.
Oh, I see.
So the smoke, but even those who smoke, who buy the smokers, when they come to me, their smoke stains are still there.
Okay.
So they're hard. No, you do the medium.
So with the thing you talk about, is it tartar?
Yeah, tartar. American call it tartar. British call it calculus.
Calculus. Yeah. So that means that if somebody comes and you clean it, it's going to come back because it's a matter of the saliva.
Yeah, right? It will pack again. So normally if you've done before, you come and we clean, we give a period, maybe 6 months. Ideally, we say once every 6 months.
Oh, okay.
But if after 6 months you come and assess and it's not much or it's very not packed, maybe once a year. If you after 3 months you see that it has packed again, you need to go back and have it cleaned off.
Okay.
Yes, because the deposits also has an effect on your gums.
Okay.
So those people who pack a lot over time, you realize that the gum either begins to bleed or get sore, and then it in effect has issues on the bone that holds the teeth.
Right.
Because it's a whole unit. The gum, the teeth, and the bone, they work together.
Yeah.
So as it affects the bone begins to shrink. Then ultimately the teeth begins, once the bone is the foundation for the tooth. So once the foundation is weak, tooth begins to wobble, and then it can ultimately do what? Fall out.
I see.
Yeah, so that's.
So which other ones? You talked about the tartar, and then you early on talk about the tooth decay as one of the things.
Yeah.
Which other common issues?
So you are looking at what is also linked with the tartar, what we call gingivitis. That's when they brush, they bleed.
Yeah.
Yeah, you have bleeding gums when you brush. That one.
I thought that was a problem of how hard the brush is, or how hard somebody is brushing.
It can be a problem of that, but also when the tartar builds up and it's not dislodged, the organisms in there get the gum inflamed.
Okay.
So until you clean, the bleeding will continue. So it's not just about the force you use to brush.
Okay.
In dentistry we call the gums gingiva. So it's called gingivitis. Itis means inflammation. So gingiva and itis, gingivitis. So that's one of the causes. Then the broader aspect you move on is what we will call periodontitis, because the gum, the bone, the teeth has something we call the periodontium. So when it gets inflamed, then it gets weakened, then the bone shrinks, then the teeth begins to wobble, and then ultimately it can fall out. So you mainly would see people coming with deposits, the tartar buildup, tooth decay, and then you have periodontitis. Yeah. I mean, these are the main activities that you would encounter.
So I want to believe that the most common one would be the tooth decay.
No, you have more of the gingivitis and periodontitis be more common than the tooth decay.
But tooth decay too, I mean, we growing up, those were the ones that we used to hear of. Caca a lot.
Because it causes pain.
Oh, right.
Because it causes pain. The gingivitis or periodontitis occasionally will cause pain, but it's not one that will disturb your sleep like
caca.
Caca, yes. Tooth decay would, as I said, the pain is only second to labor. Yes. So if you imagine the pain our mothers go through to give birth, it's only second to that one. And unfortunately, it comes at night.
Yeah.
Because the body is trying to marshal forces to override the infection at that time of the day. Because when you lie down, gravity is not acting on your blood flow. So there's uninterrupted blood flow to the site, and then there's extreme pain. And the pain, that's all you hear about a lot.
Right, yeah.
I couldn't sleep the whole night. I'm going to the dentist. I couldn't sleep the whole night. I'm going to the dentist. That's why you would think that is the most common dental disease, but you have more of the
other ones. Yes. I see. All right, let me just announce the phone lines, and I'll come back to Kaka shortly because I know a lot of people would want to hear about it. Well, exactly 24 minutes after 9. This is a business breakfast on Z101.9 FM with me, Nietzsche Bihamon. This morning, we're having a conversation to mark the World Oral Health Day, and we're talking about exactly how that connects directly to your overall well-being. And my guest in studio this morning is Dr. Harry B.K. Glover. He is a dentist and also the CEO of Life Healthcare Center, and he's helping us make sense of exactly what we're talking about this morning. You can join a conversation on 0544321019, 0544321019. If you have any questions, send them to me, and I'll read them to Doctor to respond to them. If you have any comments as well, feel free to send them 0544321019. You can also call us on 03039566641, 03039566641, and then we give you the opportunity to ask your questions or make your comments. We're streaming live on Facebook at ZFMGH and on YouTube at Z Multimedia. Please drop a comment there also, and I'll read them for you. Well, I have good news for you. We are doing some giveaway. We have a giveaway this morning on the show. Doctor has decided to do some free consultations and some free things for people. And so you're going to call us. This is how it's going to be. Just call us. We ask a question. The questions are going to be centered around brushing your teeth, something related to oral health, also about Z Multimedia, and then about Eid al-Fitr, because we are celebrating Eid today. And so call us, and then we ask a very common, very simple question. If you get it right, we give you the free consultation with Doc, and also I think some free attention, from Doctor at his facility. And so you can call us now, 0544-321019, 0544-321019, and then I give you the opportunity to answer a question, and then you get the giveaway. We're giving free dental consultation and cleaning. That is a giveaway. So please call us now, and then we give you the opportunity to be a winner of this giveaway this morning. All right, Doc, let's continue the conversation. So as I said, I was going to come back to Kaka. How would somebody know if they are beginning to develop tooth decay?
Okay, so most often clients come and tell you that food gets stuck somewhere once they are eating, and then most often they'll use a toothpick, take it out. Then later they'll come and tell you that, okay, when I eat and food gets into that hole, it's slightly painful. Because in that case, because it takes almost 2 years for to get decayed and start causing pain.
2 years.
Yes.
Okay.
It's a very slow process. But if not tackled early, it gets to a point where it gets very painful.
Okay.
So they'll come and most often they'll take it out, clean it up. Then or some of them will use they'll say they'll use chewing gum. Once you chew the gum, the
pain,
the debris that gets into the hole comes out. Then later a bit of pain, they'll take some para, the pain goes down. Then one day they take the para and then it doesn't work. Then they cannot sleep. So it's a gradual process. The body is said that it sends you several warning signs to take action. But I don't tend to fault a lot of, because there are so many horrid stories about the dentist. The dentist has so many wild tools. The dentist will inject you. The dentist will pull out your tooth. Currently, practice is a bit different.
Okay.
Even though we do those things, you need to. Patient is educated before things are done.
Right.
And there are more things to do to help bring the pain down before anything is done. So it's not like the old days that extractions were just the mainstay.
Right.
Yes. But tooth decay takes it's very patient. So if you don't tackle it early, once you come to the dentist and we take an x-ray and see the depth of the cavity, it can be filled.
So it starts with a cavity.
So yes, so the decay forms a hole. So some, depending on how your tooth is shaped, how it was created, there are varying things that you cause. Some have some very deep grooves in their teeth that retains food when they eat. Yeah. So once the grooves retain food, there's always substrate for decay. There's always substrate for decay. So you need to. That's why we say visit your dentist at least twice in a year. So that if we see anything, we'll tell you, and then we nip it in the bud before it gets
worse.
Yeah, it gets worse. Right? So yes, and then also you have some people too. The Ghanaian diet and bones, man. We love our bones. Yeah, we want to get calcium till we are 90. Right. Even though your bones are fully grown. So the coarse diet sometimes ends up breaking teeth. You see, the interesting thing is that as you grow older, your teeth get more rigid, less flexible. So you should pick your bones and your battle with the bones with caution, because some of the bones will defeat you. Yeah, so you may chew the bones and it will break the tooth, and then you have a dip whereby food can get stuck, and then it causes a decay. Also, now the bone will split the tooth into two.
Right.
That's when we have to take it out.
Well, actually, some people. I mean, how common is mouth odor?
So
is it curable too?
You see, so they are varying. So when you have a lot of tartar in your mouth, and debris, all those yellowish or greenish things around your teeth, the organisms in there release gases, causes bad breath.
Okay.
Sometimes some people have their wisdom teeth. The last tooth that comes out, doesn't come out straight. It comes out at an angle. So between the last and the last but one, there's a gap whereby food gets stuck. Once the food gets stuck and it's not dislodged, it decays, and then what will happen? It will bring foul breath. Some also would also have, when you have bleeding gums, when blood goes bad, the smell is not too good.
Okay.
So that can also give bad breath. Some also have chronic cold and will have what we call sinusitis. So with that, they'll have to see the ENT to have it sorted out.
Right.
And some too also have issues with the we call it GERD, gastroesophageal reflux, where food tries to come back into their mouth when they eat. After it goes down. So that one you have to see them. So there are varying factors. Some too. One of the most commonest ones that we encounter are people who can smell very well. So they don't have any bad odor.
Yeah.
But they can perceive very fine scents.
Okay.
So they end up sentencing either themselves or their partners to what would I say? They sentence them to some halitosis prison,
right,
or bad breath prison, that they are perceiving the scent and say, "Oh no, your breath is," but they come, you check, there's nothing. Or some people, because they have that, they all want to make sure that their breath is on point, because nobody will criticize them. Also, some people will go and meet somebody like who's got allergy issues. So he's talking to the person is always struggling with their nose, and then the person touches their nose, and they're like, "Hey, I was talking to this guy, and he touched his nose. That means that my breath is smelling." So some are not, is not the case. Some too, yes, is the case. But as I said, hard brushing would not solve those issues.
Right.
You need to have it sorted out by the dentist.
Yes. So the dentist must actually look at it and then give you what you have to do, or tell you what you have to do. Definitely. So are there certain lifestyles that we've actually accepted as a people that is causing some of these things?
The bones.
The bones is number one. We like bones too much.
I have clients who some I think it's more the females. Some of them, they tell me that, look,
they won't be happy with you
after I cook and everybody eats. The other show my husband eat. I pick bones from everybody's plate and I sit down and I chew the bones. Hey. Some of them, I tell them, "Oh, stop the bones." The doctor, "No, the bones, I can't stop. Give me another solution to my problem. After the bones, there, we are chewing the bones forever." So yeah. So, but the life, the thing that is going becoming more common of late is because now the middle class has gone up. People are more exposed to more of the refined foods. So the sugars, they're looking at the sweets, the ice cream, and all that. Because the way tooth decay occurs, you have sugar in your mouth, and especially if you don't brush at night, the sugar is acted upon by organisms in your mouth.
Right.
So be it the carbohydrates, because carbohydrates can also be broken down to sugar. So the rice, the bread, whatever you eat, the carbohydrates, the fufu, the
Yeah.
banku. Once is you don't brush at night and there's some stuck applications in your mouth, the organisms in your mouth break down the carbohydrates, it changes it to acid, and then the acid now tends to do what? Dissolve your enamel, which is the outer covering of your teeth, and that begins to form the hole, the cavity.
Okay.
So that I would say brushing at night is more important than even brushing during the day, in the morning. Because when you brush at night, you reduce the amount of substrate in your mouth.
Yeah.
And then that brings less, gives less substrate in there. Then there is less substrate for organisms to produce the acid to damage your teeth.
Okay.
Yes. So right now you will see decay because now kids are exposed to the Fanta, the Coke. When we were growing up, Fanta and Coke was a Christmas or a birthday event. But now it's the normal. There's parents bag in the fridge, there's Alvaro, there's everything. All the drinks are there.
Right.
So it can be taken, but taken in moderation.
Okay.
If you take it every day, then there's cause for concern. So all the fizzy drinks, all the refined sugars, is what is also causing more
of that.
More of that. Yes.
So we have to cut those things.
Yes, I will not say cut it off totally, but do it in moderation. And even if you do it, the last thing in your mouth before you sleep at night should be water.
Okay.
Right. So that's you. Then also
should drink water or like use that to.
You can use to you after you brush.
Okay.
But after that, nothing should go into your mouth. Aside water.
Oh, okay.
Yes. If you go and do something else, then you use something for organisms to act at night.
Then you have to brush again.
So you can take it. I won't say when you go to the party, don't take it. No. You can take it, but in moderation. Don't binge on it. Don't be doing the sweets so much throughout the day, and then you don't brush. Yes, some people, and also if you know that, fine. My mom had a lot of. Some people, there's some genetic predisposition.
Okay. So
naturally, in the family, you don't have very strong teeth. In that case, your oral hygiene has to be better than somebody whose family their teeth are very strong. So you make sure you take good care of it, because once it's gone, it's gone.
Right. Okay. I see. Now, a very important one, which is becoming quite common, is teeth whitening. We're beginning to see that a lot, and I'm chipping this in just so that I can pick your thoughts on that. Now, is it possible, first of all, is it possible to move your teeth from this, from maybe a brownish or maybe, I don't know, a darker color to a real whitening? Is it possible to do that without harming your teeth? All these teeth whitening laser things that we are seeing, are they real? Are they like something without side effects and all of that?
So God gave you your color for a reason. And then also, some of the color you get is inherited.
Okay.
Right? And the other factors that also determine your color. The baby teeth are whiter than the adult teeth.
Okay.
So you have some parents. As soon as
so it's natural.
Yes. Some of because the baby teeth contains less dentin. Dentin is the second layer of your tooth.
Okay.
It has more enamel. Enamel is what we see, the outer layer. So enamel is a bit translucent. Dentin has got color. So dentin will give you the color, ultimately shows through the enamel to give you the color that you are seeing. Now, so for parents who, when the baby teeth are coming, the adult teeth are coming out alongside the baby teeth, they will see, my kids' teeth used to be white, but now the new ones are coming, they don't look white. You can't do much about that color. So don't go scrubbing the kids' teeth to want to get into the color of the baby teeth. It will not work out.
Right.
And when you get all your adult teeth, as I said, you like your skin complexion, you inherit your color to some extent. Unless maybe sometimes when your mother takes, and that they've stopped giving that medication, something called tetracycline. You take it ends up leaving certain pigments in the teeth. Okay. But the whitening, some people don't like what I'm going to say, but whitening, I'm not a big fan of it because I feel it's not going to, it's something that would last you a lifetime.
Oh, really?
Yes, no, it will not. If I whiten for you, I know that it can last you a lifetime. I know that it's value for money. But in the Ghanaian setting, You whiten, and you can't move your teeth from maybe a brownish to a very white teeth. It will never happen.
Even with the laser thing that people are doing these days.
You see, the laser thing is normally a chemical that you put on the tooth.
Okay.
And the light is what makes the thing to start working. That activates it. So it's not actually it's laser. They will first put a chemical on your teeth, then use the blue light that has a particular wavelength on to shine on the chemical,
right?
And then it begins to sort of whiten your teeth to some extent.
Okay.
But after
Doc,
that,
you explained it further. Okay. But I have a caller on the line. I'm going to bring you back in so that you share with us. Hello, Anita. Good morning and welcome to the Business Breakfast on Z.
Good morning, Z.
How are you doing, Anita?
Please, I'm doing well by God's grace.
All right, great. Thanks so much for joining our giveaway this morning. Well, I have a very simple question for you. But just before that, tell us where you're calling us from.
Yes, I'm calling from Taifa.
Taifa, okay, all right. Anita from Taifa. So, Anita, a very simple question. How many times should you brush your teeth each day?
Oh, I think at least twice a day.
At least twice a day?
I twice a day.
Are you sure? Final answer?
Yes, please.
Okay.
Twice a day.
Okay. So, Anita, you just won yourself a free consultation and tooth cleaning at Life Healthcare Center. We'll get in touch with you. The producer will get in touch with you after the show, and then you can yes, and then you can actually arrange with the doctor, and then you go and visit and get your teeth clean, and also you get.
Okay, thank you.
All right. So congratulations to you.
Thank you.
You're most welcome. You're most welcome. We made your holiday, I guess.
Okay.
All right. So kindly.
I'm not listening to the business breakfast on
Z before, eh? This is your first time?
No, I've been listening to it. And I'm saying that I'm not listening to it just for nothing. I'm benefiting.
Oh, that's true. You benefited from that. Okay, great. All right. So tell your family and friends and get them to also call in, and then we ask a simple question. They also stand a chance of winning. All right. Thank you very much. Producer will get in touch with you. Anita.
Thank you, too.
All right. Okay. All right. Bye. All right.
Bye.
Okay, so you can also call if you just tuned in. This is Business Breakfast on Z. Today we are observing World Oral Health Day, and we're talking about the importance of oral health for overall well-being. And my guest is Dr. Harry. He is the dentist and also the founder of. He's also the CEO actually of Life Healthcare Center, and you can join a conversation by sending us a WhatsApp on 0544321019. If you have any comments, any questions, feel free to send them to us. If you also want to join the giveaway, feel free to call us on that same number, 0544321019. You get to answer a simple question, and then you stand a chance of winning. Getting the free giveaway. The free consultation and also free cleaning. As part of that. All right, so please call us now. We're also streaming live on Facebook at ZFMGH and on YouTube at Z Multimedia. So please do well to reach out to us as soon as possible, and we can give you the opportunity to get a free consultation and a free giveaway. Doc, you were talking about the laser thing that people are doing for teeth whitening, and you're saying that it is just they put some chemicals on the teeth, and then they throw the light at it,
and then it
begins to work. Yes,
because the chemical has a particular ingredient in there that is light activated.
Okay.
Yeah, but personally, as a dentist, I don't like doing it that much because of the type of diet we have in our country.
Okay.
When you do the whitening, abenquine, that's with palm oil, coffee, tea, red wine, all the greens and all that stuff, you have to cut them off. So palava sauce, gobe, all those things. Because it's like polishing your saucepan from when it's black and then go and put it back on fire. What happens? It will go black again. Yes. So if it was a permanent thing that when I do for you, it lasts you 10 years, 15 years, yes. But if you can't stop, so normally I'll tell my clients, if I see a coffee taker, no, you have to go and stop the coffee. I clean for you regular. Go and stop the coffee before I now change. So if you don't stop the coffee, then we can't whiten for you.
Can't whiten for you. I see. So what actually makes it the teeth darker? Is it the foods that we eat, like the gobe and things that you
No,
mentioned?
you have a natural color, but when you like a lot of tea and coffee, yes, it would definitely make it darker.
Make it darker. Right, Doc. I have another caller on the line. Let me just bring the person in. Rael from hello, Rael. Good morning and welcome to the Business Breakfast on Z.
Hi, good morning.
How are you doing, Rael?
I'm doing very well by God's grace. How are you doing?
Yeah, I'm doing well too by God's grace. Thank you so much for calling us. So I'm just going to ask you a question, a simple question, and then when you answer, you stand a chance of getting a giveaway this morning. Now, what is the special meal called? The special meal that Muslims eat to break their fast during Eid al-Fitr. What is it called?
Is it iftar?
Iftar. Wow. How did you know, Rayo? You're a Christian, right?
Yes, I have a Muslim friend.
Oh. Oh, okay. Iftar, right. You got that right. And congratulations. You just won yourself a free consultation and a free teeth cleaning at Life Healthcare Center. Yeah.
Thank you Jonathan. Thank you.
Yeah, most welcome. Thanks so much for calling. So the producer is going to get in touch with you, and then we arrange with you, and you can visit the facility and get a free consultation and all of that.
All right.
All right. Thank you very much for calling, Rayo. Okay, so so you can also call 0544321019, 0544321019. Answer a simple question and stand a chance of getting yourself a free consultation and also free cleaning at Life Healthcare Center. I understand that I have some more calls coming through. Please place your call as soon as possible. Look, let's continue the conversation.
So if a coffee taker or someone who likes his red wine or likes a lot of tea, it would naturally leave the pigments on your teeth.
Okay.
So if you clean and I whiten, the next moment you go back to your coffee. And for coffee and tea takers, they really like their coffee and their tea.
Okay.
So they find it difficult to stop. So before I whiten for you, you need to really stop. I see that you've stopped. So we'll have maybe another session. I see that I don't see the same stains that I see before. Before I may do that for you. The other thing that people may do to maintain their white teeth or to get whiter teeth is something they call veneers.
What's that?
So you go to the dentist, he uses his drill to shave the front of your teeth, takes molds and goes to make whitish coverings. It's like glass and sticks them on the surface of your teeth. So that's why you see the Hollywood smile, you see the celebrities having very nice, perfect teeth. They've gone to work on it.
What are the side effects of all of that?
With that one tooth tissue is gone because you cannot, as I said, tooth does not regenerate, so you cannot replace it. And then your diet must be cautious. When you have veneers, no plantain chips, no bones, no fried yam, and nuts, because it's almost like glass. It will break if you chew very hard things. So getting whiter teeth that was not given to you by God would require a lot of lifestyle adjustments. But I will say to our client, you adjust the lifestyle before you go spending that amount of money in your mouth. Because in my entire career, I have seen only I think 2 or 3 patients that have had very white teeth naturally.
Right.
And it was only one that her color matches the color that is used for whitening. Only one.
Only one.
One. And I've seen in excess of maybe 15,000 patients or 40. I've seen a lot of patients in my entire career.
So are you saying that it is not worth it?
For me, unless there's some diseased enamel that you have what we call enamel hypoplasia, that your teeth didn't develop. That one, yes, we can work on it for you. But just for regular wanting my teeth to look very white, it's not worth it.
Okay. Right. Okay, Doc, I have other callers on the line. I have Benedicta from Kaswa, right? Nungwa. Okay, Benedicta, good morning and welcome to the Business Breakfast on Z. Hello, Benedicta. Hello. All right, I think I lost Benedicta there. We'll try. Benedicta, kindly call back so that we can add you to the conversation, and then you can answer your question and stand a chance of getting a giveaway. Benedicta, hello.
Hello.
All right, great. How are you doing?
I'm doing good. You?
Yeah, I'm doing well too by God's grace. Welcome to the Business Breakfast on Z 101.9 FM. All right. Okay. So a very quick question, and then you stand a chance of getting the giveaway. Can you tell us where Z Multimedia is located?
East Legon.
East Legon. Can you be specific? Where in East Legon? Okay, maybe you don't get that one, but you got a East Legon, right? And so we'll just let it. Yeah, congratulations on that, Benedicta. So you've won yourself a free. Hello.
Yes, please. Please, can I be heard?
Yes, loud and clear. Your name and where you are calling us from, please.
I'm Benedicta.
Oh, this is Benedicta. Or another Benedicta.
No, the same Benedicta.
The same. Okay. Right. Okay. Yes. So Benedicta, thank you very much. You've won yourself a free consultation and free cleaning at Life Healthcare Center, and so the producer will get in touch with you, and then we'll arrange and get you to visit the facility and get your teeth cleaned, and also get your free consultation. But thanks so much for calling us this morning.
Okay. Thanks.
All right. Enjoy the rest of your holiday. All right. Okay. So, yes, you can also call us. We still have some more callers calling us this morning, but you can also place a call 0544321019, 0544321019. It's a free giveaway for you, and that is what we are doing this morning to mark the World Oral Health Day. I have another caller on the line. Hello.
Hello. I didn't get asked my question.
Oh, you have a question? Okay, go ahead.
Yes. Please. How do you handle? Is it safe or is it healthy for you to brush more than twice a day? Because sometimes my teeth usually becomes very sensitive. I have to brush my teeth more than twice a day.
Doc, so she's asking, is it Benedicta?
Yes. Please.
Oh, okay, all right. Doc, so she's asking, she's asking that is it okay to brush more than twice a day?
Some people will brush after every meal. That's allowed if you want, but you should do it. The force you apply should be with moderation. Don't go scrubbing. So maybe you have your morning, you have your evening. Maybe you can do a midpoint, a middle one in the afternoon.
Okay.
Yes, but you don't need to brush after every. Some people take it to the extra. They want to keep their teeth very clean and all that, but morning and evening, very important. But if you are doing more than that, then make sure that the force you are applying is not beyond measure. Other than that, you begin to damage your teeth. Yeah.
Right. Okay. All right, Benedicta, I hope that answers your question.
Yes, please.
All right, great. All right, thank you very much. Okay, you're most welcome. All right, you can also call us on 0544321019, 0544321019, and then we give you the opportunity to ask your question or make a comment, and also stand a chance of getting a giveaway this morning from us at Z101.9 FM, your lifestyle, leisure, and business radio. All right, Doc. So let's touch on a few other things, and then we can wrap up the conversation. Our time is almost up. So a very important thing that I think we also need to pay attention to is the fact that, some people think that they have to get a pain before they move to the dentist. And I think you highlighted that early on when you were making some points. Do you think that people should wait for preventive care, or they should do preventive care, or actually do more like a reactive one? They should wait. Which one is more important?
With most health conditions now, you are better off having preventive, right? Preventive care, because sometimes the point at which you will seek help, the damage that has happened has gone beyond what can be salvaged. So when pain occurs, as I said earlier on, that's the point. When you get to that point, then there are only two options: either I pull out your tooth, or I do a procedure we call a root canal. That depends on the amount of tooth tissue you have left in the mouth.
Okay.
So you don't wait for pain to drive you to the dentist. No. Once it gets there, the tooth is a goner. And once it's gone, for me to fix it back, very expensive.
Very expensive. Like how much?
It can cost you from, depending on what you want, it can cost you from maybe 2,000, 3,000 to about much as 30,000, 40,000 cedis.
Wow.
Yeah.
That's the same teeth that you got free and you didn't take
so
care
I'll
of
tell you that. So if you make the teeth go bad, you give me more money. You get.
All right. Okay, Doc, I have another caller on the line. Let me just speak to. Hello.
Hello.
Hi. Your name and where you're calling us from?
Please, my name is Daniel. I'm
Daniel.
calling from
From where?
From Tema.
Okay, Daniel from Tema. Daniel, thanks so much. This is a business breakfast on Z. Do you have a question for us?
Yes. Please, my fiancée is battling from this issue that you guys are talking about, and I would love to bring her to the place that the hospital does.
Oh, okay, so that she can come in.
So he wants to win this for his fiancée.
So you want to win for your fiancée, huh?
If it could be possible, or
okay.
I can use mine and then also pay for her.
All right. Okay. So my question to you is that can you name 3 flagship shows on Z101.9 FM?
To be honest, that one I don't have no.
Oh,
but you are on one right now.
Yes. Okay. All right.
I was just tuning in and I saw the conversation. And
wow. Okay.
it really touched me.
All right. I'm going to give you another chance and ask a different question, but you're going to promise me that you will keep listening to Z.
Yeah, I promise.
Okay, you promise. All right. Okay, so another question to you. So what is the outer layer of the tooth called?
The outer layer.
Layer of the tooth, yeah. What is it called?
Is it a gum?
No, another try.
The white part you see.
The white part that you see.
The teeth itself, the bone.
No. Okay, maybe last chance, and then if you don't get it, then let your girlfriend also call, so maybe she will get it for herself. Okay. All right. So we are sorry. So just
for him, let me give him a special treat.
A special treat. Oh, so you just want yourself the same consultation anyway. Doc wants to give you a special treat. So the producer will get in touch with you, and then you can we can arrange with that. Okay. Thank you very much for calling. I have another caller on the line. Hello.
Hello.
All right. Good morning. You're welcome to the Business Breakfast on Z.
Thank you.
All right. May I know your name and where you're calling us from?
My name is Manuela. I'm calling from Tema.
Nabella.
Emanuela.
Emanuela from Tema. Okay. Emanuela, do you have a question for us or you want to join the giveaway?
I want to join the giveaway.
Oh, I see. Everybody likes the giveaway. Anyway, okay. Emanuela, what is one food you should avoid to keep your teeth healthy?
Your teeth.
Yes.
Sugar food.
Sugary foods, right. Emanuela, congratulations. You just won yourself a free consultation and cleaning at Life Healthcare Center. And so please, we'll arrange with you. Producer will get in touch with you, and then you can visit the facility. Thanks so much for calling, and keep listening to Z101.9 FM. All right. Thank you very much, Emanuela. All right. So our time is up, but I can see that some people are still calling, and so maybe we'll just do like 2 more, and then we can wrap up this morning. Yes. Okay, Doc. Let's finalize. So you were talking about the fact that preventive is more important and it's less expensive compared to being reactive or waiting for treatment and all of that. Okay. Now, many people avoid the dental visits due to the cost. How should we rethink oral health as an investment and not?
So if you think of the possibility of paying about 30,000-40,000 cedis to get something fixed, as compared to spending maybe 600, 700 cedis, 800 cedis to have it nipped in the bud, I think it's a worthy investment. And then also, you think about the pain that you may get at night that will affect your day. The following day, productivity will be less. If you go into this, taking out the time you will miss off having to recuperate. So having the trouble and sorting it out has a prolonged effect on your productivity, your economic outcome, and all that, as compared to nipping it in the bud and stopping it early.
Okay.
So, and also, don't follow don't let somebody's experience be your experience.
Okay.
That I went and the tooth was taken out and it was so much, it was so painful. No, don't let that limit you from going to the dentist. Because everybody's experience is different. Right. Okay. And practice in the past is not practice now. Now we like well-informed clients. We like letting clients understand what's going to be done before we proceed. If you don't understand what is done, we give you information, go and research, come, ask questions before we proceed.
Right.
We don't just catch you, tell you, open your mouth, then we are taking out your tooth. No. That's not how it is the practice is today.
All right. Okay, Doc, I have another caller. Let me just take my last call and then we wrap up in studio. Hello?
Hello.
Yeah, welcome to the Business Breakfast on Z. Your name and where you're calling us from, please.
My name is Patience. I'm calling from Accra.
Your name is what?
Patience.
Patience from Accra.
Yes.
Okay, Patience, thanks so much for calling us. Do you want to ask a question or you want to join the giveaway?
I want to join the giveaway.
Oh, wow. Everybody likes the giveaway. Okay, Patience, so a quick question. Can you mention the 3 philosophies of Z101 ZFM?
Oh, I don't want that. I just tuned in and I saw my favorite doctor, so I decided.
Wow. Patience wants to vibe doctor. They said he can give free consultation. But anyway, let me change the question for you, Patience, so that maybe yes. How often should you visit the dentist?
Please, this month or yearly.
How so? Explain.
Sorry?
How do you mean?
Like,
you mean every 6 months?
Yes, please. And if because of work schedule you can't make it every 6 months, then you come yearly, once a year.
Doc is nodding, so I'm sure that your answer is correct. Congratulations, Patience. You just won yourself. All right, Patience. So you just won yourself a free consultation and also teeth cleaning at Life Healthcare Center.
And we are Patient and Peggy. Hello?
Yes.
Yeah.
Please, we are Patient and Peggy.
Patience and Peggy.
Enrolled, so we come for free consultation.
Hey. The 2 people. All right. Anyway, doctor will see about that. And for this, I'll get in touch with you. Thanks so much for calling. Please keep listening to Z101.9 FM.
Okay.
All right. Okay. All right. All right, Doc. Let's wrap up now. So, if there's anybody listening to us, some basic things that they can do to protect their health, their oral health, from today.
So, for parents, start cleaning the kids' mouth as soon as they are born, so that as they grow older, they will not battle you when you are brushing their teeth.
Yeah.
Limit the amount of sugar you give them when they are kids, and also make sure that if you are breastfeeding them, don't breastfeed them throughout the night with milk stuck in your mouth, because milk contains sugar.
Okay.
It can cause decay. Make sure that the last thing they get in your mouth before they sleep is water. Don't give them Milo and they will sleep with the Milo. Kids who do that will end up getting a lot of tooth decay. If you want them to stop, dilute the Milo. Make the Milo quite watery, not sweet, so that over time they'll give it up. Visit your dentist twice a year. If we see that you need it once a year, we'll let you know. If you need it more than once a year, we'll let you know. as we're getting more economically stable, limit the amount of refined sugars that you take.
Okay.
And then for the typical Ghanaian, I'll say for the bones, battle the bones you can defeat. Don't go and choose some layer bone or some confirmed bone or some turkey bone that will break your teeth. Battle the bones that you can defeat. And keep your teeth healthy, because once the tooth is gone, it's gone for life. It's something God gave that gives to you for free. Don't destroy it for you to come and have to pay money for it. So that's it.
All right, Doc. Thank you very much.
Yeah. And then for those who won, for Life Healthcare, we have a branch at Achimota Mall, Junction Mall, Accra Mall, and we are soon coming to Tema, and then one at ANC Corner. So depending on where they are,
repeat them so that.
So we have Achimota Mall, Junction Mall, ANC Corner, and then we are soon coming to Tema Community 5.
Oh, okay. All right. Okay, Doc, thank you very much. Myself, I'm going to come.
I'm sure.
Solomon, are you also yes, welcome. Welcome. And DJ Wade, welcome to one any of your branches for the consultation. Thank you so much.
Welcome.
Yes,
You're
really
welcome.
grateful that you joined us this morning. All right. So Dr. Harry B.K. Glover is a dentist and also the CEO of Life Healthcare Center, and he joined us this morning talking about the importance of oral health for overall well-being. It's been a very good conversation. Doc, thank you so much once again for coming. And to all of you who listen to this conversation, thank you very much. We're going to have a very brief conversation about Eid. We promised you that, and so we're going to do that shortly. I have joining me over the phone lines Azuri Imoru Abdullah, and he is our guest this morning. He's a Muslim and he's going to share a little bit about Eid with us. But we'll take a quick music break, and when we return, we get into that conversation. Please don't go anywhere.